I'm welcoming Angela Culbreth. She is a licensed professional counselor specializing in sexual and relationship therapy. And today our topic on my YouTube channel at Dr. Laura Beaty. Please subscribe. The topic today is low sexual desire, and we have a lot to cover.
Yes, we do.
So let's start with defining low sexual desire. So I looked up some statistics because I'm always the statistics nerd. It's not a fine stat. Between 40 and 70% of women will have had low sexual desire at some point in their life. Out of that group, 20% actually have a diagnosis of hypoactive sexual desire disorder.
That's right.
That's the DSM diagnostic criteria. You fit it. So low sexual desire, of course, can come and go. But for these HSDD people, it sort of is a shadow that they carry with them kind of always, and it really bothers them. That's a key. It bothers them.
Yes.
So I'm going to also talk about men, and then I'm going to turn it over to you to give us some more definition points. But 15 to 30% of men also have low sexual desire at some point. I don't think that there's really a diagnostic DSM criteria for them. Only about 1% meet that definition.
Right.
That does not surprise me, but
Mm-hmm.
I'm sure you work with this regularly.
I do. Yes. This is the number one thing that brings people into the office of a sex therapist is having low or absent sexual desire. That's the thing that we treat the most for individuals. And then when we're treating people in a couples setting, the most common thing that we treat is desire discrepancy, which usually means one person wants sex more than the other person. Sometimes it's they want different types of sex, but usually it has to do more with the frequency of sex. And often by the time people end up in a sex therapist's office, they've gotten pretty polarized where it seems like one person wants sex all the time and the other person wants sex never. And then we have to find the way back for that couple to meet in the middle, which is probably more likely where they were early in the relationship.
When all of the hormones were really pushing them to the intensity of that early sexual desire that I think everyone remembers and redesires.
Oh, yeah. I mean, it's a chemical thing, right? Like we're swimming in a chemical soup.
Oxytocin's up.
Oh, my gosh.
Norepinephrine's up.
Falling in love and losing your mind and whatever. That is what that era is like. And usually for 6 months to 2 years, people are coasting on the magic carpet ride of those chemicals, and things can feel really good. And sometimes in my office, that's what people want to get back to. It's like it was in the beginning. And it's helpful for me to know for them what it was like because that lets me know what their ceiling has been in the past. Some couples don't ever really have that magic carpet ride. Most do. And sometimes the bad news I need to give is that we might not get back to that exactly, but we can look at what happened after that. What happened after that 6 month to 2 year period? What were the norms maybe before other stressors came into the relationship, like mortgages and second jobs and children and sick parents and the sort of things that kind of crowd the plate.
Pull us away from sexual thoughts, for sure. And hypoactive sexual desire disorder, I think we'll spend certainly a subset on that. But since the majority of people that we're talking to and that hopefully will find us on YouTube are dealing more with the ebbs and flows of desire, I'd probably like to spend the most time talking about that and going back to what you see that causes it and some of the steps that couples can take or individuals can take. Desire discrepancy, I think, is also something that I see as a primary care doctor and have taken care of many times and just immediately had come into my head that maybe we can talk about later, but I'll put fake names to the people who worry if they're. But having the diagnosis of low sexual desire means that you're having less sex. Tell me what you think. Just not thinking about it during the day.
These are people that would say that sort of thing to me. It never crosses my mind. I think if he didn't want to have sex, we never would again. I would be okay with that. It just isn't a drive. It's like the appetite's gone. Mm-hmm. Some people miss it. Most people miss it. At least the ones that seek me out are missing it. But some don't. And then that, of course, gets us right into the questions about, is this been their norm is this how it's been for them forever? So that's some of the first stuff we want to know is is it lifelong, and maybe they're trying to find something they've never found before, or was it acquired at some point? There was a better stage of functioning, maybe decades of it up until some point. And then also I need to know, is it generalized or specific? So does this mean there's no desire to masturbate? There's no fantasy about other partners. It's really absent in that person's entire body, like in their entire mind, or are they not wanting to have sex with their partner? And that's a different thing. So generalized or specific, that's something we need to know. And then lifelong or acquired. Those are different types of HSDD.
Let's dive into the acquired. So not lifelong, but what would be a standard encounter with a couple, let's say, that come to see you because all of a sudden there has been a change? And I think some of the most typical things that as groups of women we sit around and talk about and know that it happens, as well as seeing it in our respective practices, would be life-altering changes back to the point of multiple kids and multiple activities. You're in the top of your professional career. Your parents are aging, so you don't have the room for sex. I think when we talk about that,
Right.
and I'm gonna even make it talk about that woman,
Right.
we're talking about a high percentage of the periods of low sexual desire. I mean, I can recall when my daughter was little having periods of really I remember even talking to you about it
Right.
at friend groups, going, give me some pointers.
Right.
So
Right.
let's give them some pointers.
Yeah. Yeah. That's the getting your groove back kind of quest that a lot of women have. And actually, I think that we probably should just clarify for this conversation. Let's talk about low desire in women, because let's come back on a different day and talk about low desire in men, because low desire in men is a thing. And
it deserves its own time.
It deserves its own time, because it's not the same thing. It's the same way that in a lot of ways medicine women have kind of needed to fit into men's studies and such as that. I don't think that we should do the same thing here with low desire. Men who have low or absent desire suffer in a particular sort of way because they're men.
Mm-hmm.
And so I don't want to just kind of side note that a little bit here and there. Let's just talk about women with low desire today. We're probably going to be pretty heterosexist in the conversation and talk about women who have male partners, probably married. So those kind of words, let's just put some caveats to this. Those are probably going to be the kind of words that we use: husband, married, things like that. And we know that not everybody fits under that umbrella. There are people for sure that will hear what we say and don't feel represented in that.
Right.
But a lot of people will. And then let's put a pin in talking about the men, because I really do think, like I said, that there's a special kind of suffering that goes along with being a man who does not want to have sex. So that'll be a different thing.
Tabled.
That's what that is. That's tabled. So for a woman who used to enjoy sex, who doesn't enjoy sex anymore, one of the first things we want to look at, of course, is, have you talked to your doctor about this?
Yep.
Because we do want
You, me.
Yes, exactly. Because a lot of times it can mean something, like something around thyroid or something around something else hormonally. You're the one that would speak to that.
Yeah, make sure that the boxes are checked. Thyroid's normal, hormones are normal. You're not on a medication that's potentially causing a problem that could be tweaked or fixed.
Right? Yeah, the medication side effect is one I have to think about a lot.
So in this instance, let's pretend all ruled out, and I'm tossing them back to you.
And we've also ruled out pain, because that's the other thing.
Well, and pain, and I did want to definitely spend some time on that from a hormonal standpoint. A lot of times for women, it is vaginal atrophy pain can be what starts the low desire process, because it hurts.
It hurts.
And then there are other women that have issues with vaginismus or just vaginal spasms that cause penetration intercourse to be almost impossible.
Right.
And I'm sure there's a large percentage of that group of women that eventually will fall under the low sexual desire, because again, it hurts.
Right. That's
and
right.
It's hard to put your head around something that you would want to do that just is painful.
Right. So that needs addressing and making sure that gets ruled out. And I ask women those questions, and I'll talk about pain, discomfort, use a lot of different words like that to make sure that there's nothing like that that's a part of it. Because that's like putting your hand on the stove, right? Like, you don't want to do that again. We're wired to want to survive and pain to avoid pain. And so if something is hurt, you're going to want to do it less. And then there's going to be more muscle tension and less blood flow and things like that that go along with pain and guarding against pain. That creates its own cascade of effects. So if pain's involved, that's a different sort of treatment approach. But if pain is not a thing and there's not a medication side effect and there's not thyroid, then we look, of course, like, is there depression or anxiety, something like that that makes sense of it from a mental health perspective. Then usually one of the first things I want to understand from a woman is, are you okay with your low desire? I get a lot of interesting answers for that. Sometimes very clearly, like, women will cry, be sad about, no, I really miss this. I feel like something is missing. That makes sense to me. I understand that. Other times I hear things more like, I would be okay if I never wanted this again, but I don't want him to leave me, or I'm tired of him being upset about it or something. If you could just help me want this enough to keep things okay between us. That's a tougher gig, quite frankly, to help somebody just want a little tiny bit or be okay a little tiny bit.
The case I was thinking of, I think this is an appropriate place to throw it in. I saw the couple, each as primary care patients, and I saw the man for his physical. They had been married a long time, probably 40 years, and he wanted to check his testosterone. His testosterone was a little low. He wanted to supplement. We started talking through all of that. And then, oh, may I have I'm also having some issues with erectile dysfunction. We talked through that, gave him a prescription for Viagra, saw the wife maybe a month later, and she was livid. She was so upset that I gave him a prescription for Viagra and was putting him on testosterone and basically said, if sex is a part of it, I'm out. And I was really floored. Yeah.
Yeah.
And their marriage was quite complicated, and I found out more about it at that point because I had a lot thrown at me, and I don't know where they ended up in their couple mess, but that was a challenge, and that one was kind of shocking for me. But when I look at it now, the number of long-term married people that go without sex is a pretty high number.
It's a pretty high number. I've long been told in my field, numbers that we toss around, it's about 20 to 25% of couples, long-term couples, don't ever really get out of that low sex, no sex category. And the way we think about it clinically is we consider it a sexless relationship, or no sex is if there's under 12 encounters a year, so less than once a month. And then we would put couples in the low sex category if it's less than 26, so really like less than twice a month. If there's no attempt at a mutually sexually satisfying encounter, we can't just call it sex, but like right. If there's no effort to do something fun together like that, then they put in those categories. And I think historically people would have thought that older couples fall into those patterns at some point. That isn't really true. What happens is after that initial limerence period and the new relationship energy and the magic carpet ride, they don't really ever take off in creating a couple sexual style that they can sustain over time, that really does suit the both of them, that works for them. There are probably a lot of reasons developmentally in relationships, but sex is such a tricky thing. It's like it requires like the most skill that we have relationally, and yet we talk about it the least, and we've learned the least in a lot of ways about it. And so we don't bring our best skill to the thing that really needs our best skill. And also early in relationships like that, a lot of times people are still maybe not quite telling the whole truth about who they are and what they like and that sort of stuff. And so styles get created that maybe just aren't super compelling, ways of having sex that feel boring, and aren't, like I said, aren't that exciting and kind of easy to let go after a while. So that's one way that it works. Other ways, things are good and this couple does take off and they have 5 or 10 or 15 or 20 years of good sex, and then something happens.
It's almost more tragic.
Right. Because then it's like, where did it go? And we've had this special way of communicating and of partnering with each other that's gone now. It's like a language that they don't have access to anymore, an activity that like has made them special as a couple. It's sad. And also when sex is working for a couple, if you ask them like the top 5 reasons why they're happy, they're not necessarily going to say because we have a great sex life. It's almost like it's easy to take that for granted when it's working. But when it's not working, couples will attribute almost all of their problems to the fact that they don't have a good sex life. Like, we can't decide who's going to take the trash out because we don't even have good sex. Like, it's somehow all roads lead back to that when it's not working. So it's important. And so if a woman comes in and she's sad about her desire being absent at this point, then so that's the first thing I want to do is understand, is this a problem for her? Often it is going to be a problem for her. And then I want to ask her my top 10 magic question, which is, let's brainstorm right now. Let's whiteboard this. I literally have a whiteboard, and I'm not afraid to use it. I say on my little colored markers, but I want her opinion on the top 10 reasons why her libido went away. A lot of times clients will come in and they'll tell me why, like because I'm in perimenopause, or because I have a thyroid problem, or because I've gained 30 pounds and I don't feel good about myself, because I'm working that extra job and I'm tired. They will tell me the reason why. And so I play along with that, and I'll admit that that's probably 95% of the problem has been identified. But let's just brainstorm the other 5. When in fact, I think usually there's some truth in what they've perceived, but that there are probably other factors that are fairly invisible to them that might be easier for us to fix. Like maybe the fact that there's something hormonally going on, or there's a medical thing, or there's something in their body or whatever that we can't really work with. That doesn't mean that all is lost. We just need to look at the other factors involved. So we start with the top 10 list and see what they come up with. And usually there are things on that list like, I'm tired. I've got too much on my to-do list. I'm mad at a lot of people. I'm sad about a lot of things. And that starts to paint a picture.
And I'm guessing that relationship issues are also on that list.
That's often that I'm mad about a lot of things, is in that relationship issues piece. Yeah.
That's tough, but I do feel like you are kind of pulling back the layers.
That's
because
right.
I almost wonder, perimenopause, of course, can cause some significant barriers, but I feel like most of the women that I've worked with that have a good sex life going into it have a good sex life coming out of it.
I agree.
But potentially those that have all of these other issues, it's all of a sudden a reason to not.
Yes.
You know, it's sort of like calling I have a headache, you know, and my body won't allow me to, therefore I can now have a reason to say no. And then that creates probably a bigger gulf between the couple. But
yeah, I can totally see that. And if we also kind of drop into what's often going on for women around perimenopause, what do we have? Adolescents or kids launching into the world, well or not well. Parents who are aging, well or not well. Jobs changing, bodies changing, partners maybe at a peak professionally.
And I was just thinking either probably a relationship that has aged, or if it is the end of one relationship, possibly incorporating newer relationships in that mix of life that is so busy.
That's
I mean,
right.
I really think that is probably mentally and physically the busiest time of our lives.
It's a heavy time. It is. And then to be hit, I think about just the injustice sometimes of being in a household where there are kids, like teenagers, dealing with all sorts of hormonal stuff right at the same time that mom is dealing with hormonal stuff. Like, it's like, this is
like a big joke.
It's like a big joke. Like, it's not funny. So yes. So it can be, I think, one of those where there's been a gathering storm maybe for a long time, or a lot of factors that land at once. And then all of a sudden it's not there anymore. It's not accessible, and it's creating problems in the relationship. Certainly can create problems in somebody's self-image also. If she's always seen herself as a sexual person, to not feel that way anymore also feels like a loss. Breast
cancer just came into my head. I think a lot of women after losing a breast go through a stage of loss and grief, and can impact sexually as well as weight fluctuations. Yes.
Right. Those things.
Our identity can, how we see ourselves, if it's changing, can sometimes rock things. I'm trying to think through the advice that I often give someone before I would suggest that they see marriage and sex therapist, or relationship and sex therapist. Not fair to make all of these people married.
Right. They're not all married. Not everyone's married.
Or even alone. I think it can be a problem. You don't even have to be in a relationship.
That's absolutely true.
But often I will talk about making the time for yourself and to think about it. I mean, personally, I find that on my busiest day, sex is not going to cross over into my brain
Right.
very often. Whereas if I have a day or two off where I'm really spending some time allowing my brain to rest, all of a sudden it's making it's showing itself, and it
Right.
might be a song that I hear or a perfume that I smell or a scene that I see, and there's a sexual thought that comes through. So I think the biggest thing is people have to find time individually and as a couple, and that's imperative, and that's assuming that there's not a major relationship problem.
Right. That I think is another important thing to be overt about, is that assumption. Because if there is, then that's a different course of treatment to sort that sort of thing out. One of my mentors loved to say that sometimes low desire is a sign of good judgment. And that sounds kind of sarcastic and snarky and whatever, but also I think sometimes there's truth in that. That goes along with the idea that not always, but that sometimes if somebody doesn't want sex, it's because the sex doesn't feel worth wanting or it doesn't feel safe to want. There's something about it that's not working really for who they are. Those are things to consider there. But what you bring up is the role even just of stress in someone's sexuality. That if we think about what we're doing when we're stressed, which is trying to survive and process quickly and do all the things we need to do when we're running from the lion, right? It's not a great time to get super in the mood.
Right.
Right? That'd be a distraction, right? We don't need blood flow going there. We don't need the distracting thoughts, right? Like during times of stress, we really need to be focused on other things. And that is often what happens, I think, in the modern world, is that our bodies still kind of do that primitive thing when in fact maybe it would be safe to want sex in the kind of stress that we're talking about. But stress management is a big piece of the work in sex therapy with helping people get their libido back, as is what you brought up around priorities. When I tell people that they're going to have to prioritize sex, I usually get pushback with like, what gives then? Like, because I'm not exactly sitting around looking for things to focus on or new priorities or whatever. My plate's feeling pretty full, which brings me to a topic I love to talk about with people, which is the idea of strategic neglect. Like, we have to have strategies in our lives for what to neglect because we're going to have to neglect things. I don't know anybody that can get everything done. I really don't. And so then there has to be some sort of strategy for if I'm saying yes to this, I'm intentionally saying no to something else. Like if I'm saying yes to getting the carpet perfectly vacuumed every night before I go to bed, I might be saying no to time with my partner. I might be saying no to time when I could actually relax or go sit in the hot tub or go to bed a little earlier or whatever. So what do I really want to neglect? Is it the lines in the carpet or is it those other things that I could be doing instead? So there's something, I think we've been sold a message that we really can do everything or we should be able to do everything, but we can't.
We cannot.
We cannot. And so some acceptance around that and then an actually like wise strategy of neglect, I think is really important. Too often, people are neglecting their sex life in service of other things that if they were conscious of it, they wouldn't do that on purpose.
And I'm sure you see that a lot when it comes to a relationship ending, people kind of lamenting and wishing that they could go back and revisit some of the choices they made along the way.
Right.
I do remember when I was starting my practice and my daughter was young, I don't think my husband and I ever had a true desire mismatch, but we had just a bedtime mismatch.
Yeah.
And we had a different way of prioritizing. For him, it was the last box he wanted to check. For me, if my head hit the pillow and sleep came into my mind, that was it. So we had to, I do remember vividly having a conversation of, you're going to have to move me up the priority list and save some of your other stuff for after I'm asleep, or it's not going to happen.
Yes.
So I got moved up. But
Good. I'm glad
sometimes
you
it's
did.
as simple as that.
Yes, it is.
But even that, I think it was months in the making before we had that conversation, because before you're too busy. You're too
Right.
busy to sit and talk about it. If you're too busy to have it, you're too busy to talk about it.
That's right.
So interesting.
It is. And y'all were advanced because you could talk about it. There are a lot of couples that somehow have put a sex life together without ever really talking about it. And so then when it's time to talk about how to solve a problem, they have to learn the whole new skill of how do we even talk about our sex life. So that part's challenging also, but the mismatches around schedules and who needs to be in bed at what time or up at what time, who naturally wants to have sex in the evenings versus the mornings, things like that. Those kind of logistical things, they can matter a lot. I remember hearing about a study years ago where couples that don't work, they were looking at like retired couples and couples who, for whatever other reason, aren't working during the day, and found that the afternoon, so that whole afternoon delight song, like they were onto something. The afternoon is a time that a lot of couples default into having a sexual encounter with each other if they don't have all of the demands of jobs and kids and whatever. But so instead, what we do is we push sex into the margins. It's a bed activity, so it's going to happen right before bed or right when you wake up, or maybe every now and then in the middle of the night something happens. But usually what that means, like at bedtime and with waking up, we're not really at our very best then. And what people are trying to do is power down or just get going in the morning. So instead of just relaxing, now you're trying to get aroused at the same time. Like, and I know that real sexual arousal is like a nice combination of relaxation and arousal together. But still, it's an interesting thing to ask of yourself right on the cusp of going to bed. But that is the norm.
Yes, it is. And it's
Mm-hmm.
a bit unfortunate, and it is worth a conversation.
Mm-hmm.
And I think probably, I may be wrong, but I'm thinking that at least for women that have this issue come up as not an early part of their sex life problem, but later, is body image.
Yeah.
And how you help people with that issue, because I do feel like I'm not as equipped as a primary care doc to help someone manage that. And that is one that I'll tend to send to therapy.
That can really become a thing. And it's sad to see people get that wrapped up around something, because usually it's, it's sure there can be profound weight changes or profound body changes because of surgeries or things like that have happened. So scars or, like you said, breast surgery, things like that, if there's been cancer, those sorts of things. But for a lot of people, it's normal body changes of aging. In some message, they've internalized that their body isn't supposed to have those changes. Almost always the person with the issue is the person with the issue. It's not the partner. Sometimes it is. But usually that's one of the things that we end up kind of doing some reality testing around. Who is this a problem for? Sometimes that can help people to just get some reality around that. Like, this isn't actually like my partner still getting turned on.
I'm remembering a conversation with friends where you were talking to someone that was having this issue, and you were saying, now really, if you were at home naked in bed, would your husband dismiss you? And the answer was wholeheartedly no.
Right.
So back to your point of the issue is usually with the person and not with the other. So
yeah. Right. So then there's acceptance, right? The work of acceptance and the tough things that we go through around aging, I think in general, with accepting that. I mean, not to really be a downer, but there's like a mortality piece involved with all that. Like, my body is going to change. My body's going to fall apart, and eventually it's not going to even be here anymore. Like that is involved with body image. And so, again, having some acceptance around that, doing some grief work if that's what's required. I have a friend that just did a burlesque class, and she was talking about how much crying went on during the practice sessions.
That's sad.
It's sad. She thought she just got some cute little Valentine's gift. It wasn't just a cute little Valentine's gift. These performers, these women, they were all women performers, and it was all the first time for them to go do this burlesque performance. But they and the teachers made space for it. They were prepared, but they said there's going to be a lot of grief in this room about accepting yourself at your age, accepting your body as it is, maybe saying goodbye to a body that you don't have anymore or that you never had. That there's a lot of grief in that, and they had to kind of go through that grief to be able to get to the point where they could put together a performance that felt like what they wanted to share. Mm-hmm. It wasn't optional. So for a lot of our clients, it's not going to be optional either to do that work of really making peace with their bodies.
I feel like this is a good break spot. So I'm going to take a little break here, and we will come back and talk about more specific. I like your terminology on my notes here, desire killers.
Yes.
So how do you start the process with somebody that is seeking your help for what we're talking about today, low sexual desire?
Yeah, sure. So I like to start off by knowing, first of all, is it been that way forever? Did it come on? Is it just that way with your partner? Like, do you still like to masturbate every day, or you have fantasies about other people? So is it that same, that generalized or acquired, lifelong or acquired, generalized or specific, right? So those, I want to understand those things. If they've talked to the doctor, I want to understand that. I want to get the top 10 list of why they think their libido is low, what's caused a change for them. And then I, with their permission, want to ask them to describe for me their typical sexual encounter. And I ask for as much detail as they can give me. Like, if I'd been a fly on the wall, what would I have seen? Usually descriptions saw something like that, like, well, it was bedtime one night and we had sex. And that's a great starting point. But then, right, then it's like, tell me a little more. Tell me a little more. Because I really want to understand, like, what they're doing that they're trying to get back to. And where during these encounters, or this one encounter that I want described to me, where was she feeling absent desire, a little bit of desire, a little bit more, just kind of understand the nuance about that sort of typical sexual encounter. Then I want her to describe for me some of her favorite sexual memories. And if we're in the room with her partner, we're going to talk about favorite sexual memories in the relationship. Okay. If he's not in the room, we're going to talk about in her whole life. Just tell me, when you think about your favorite sexual memories, what comes up for you? Because I want to listen for themes. Like, was she always on vacation, or was it always with somebody and it was a first time? Was there something going on in there, a setting thing, something about the partner, something about how she was feeling? What were those conditions that were part of her favorite sexual memories? Because that can tell me a lot about what we call her conditions for good sex. There are 3 aspects to somebody's conditions for good sex, and that's how they are feeling about their own self, conditions related to them, conditions related to the partner, and conditions related to the environment. So to use a very basic example, it might be something like, I need to feel well rested. I need it to be someone whose name I know, and I need the curtains to be drawn, right? So that's myself, my partner, my environment. That's one little example of that. But there are lots of things that I hear in people's favorite sexual memories. And then usually I can see the stark contrast between their favorite sexual memories and what she's just described for me as a typical sexual encounter, which then makes me start to wonder, like, are her conditions for good sex not being met? Is her lack of wanting sex kind of a sign of good judgment? Like, that's not very fun. I would rather watch Modern Family than go do that. That's not worth my time or energy or effort. So I need to understand those things. And I also want to understand, once she starts having sex, does she start feeling more desire? Because there are 2 types of sexual desire, and a lot of people don't understand that we will feel those things differently. And the first one is spontaneous desire. The example I use for that is, you're in the middle of doing something, you start to feel hungry, and so you go to the fridge and you get something to eat. Most women, even if they're not comfortable talking about sexual desire, appetite, can understand food desire and appetite. So I usually use that as an example. That's what that feels like. It's spontaneous desire. You noticed you wanted something, and so then you went and you did something about it. That happens sometimes. Sometimes that's how women end up having sex. More often, it's the other example of, like, responsive desire, which means once we get started and we get a little bit warmed up, we get into that sexual space, then we want to keep doing what we're doing. That counts as desire. It wasn't there before the encounter. That was just willingness. There was willingness to start. But once you start, if you start feeling like, I like this, and I hope the phone doesn't ring, I hope nobody knocks on the door, I hope we get to keep doing this, that's responsive desire. And my example for that is, like, when you're at a party and somebody's walking by with hors d'oeuvres and you're not really hungry, but you take one because it's the thing to do, and you have a bite of it, and it's really good.
Another one.
Yeah. And so then you're like, I hope he comes back over this way because I would like some more of that. That's what responsive desire feels like. So you're not going to feel it in the middle of writing a presentation or folding laundry or whatever, but you are going to feel it once you get started. So if a woman's feeling that way, then we have a different way to talk about it, because she might be more normal than she would realize if she's feeling abundance, a plenty of sexual desire after she gets started. She might still miss the spontaneous desire, but we can probably still craft a good sex life around somebody that has good responsive desire. So I want to understand that. Then I usually do ask the question about, would you say it's sex worth having, which can feel a little insulting, but we have to have honest conversations here about like, no, actually, we're not having very good sex. It's not super fun. Doesn't feel great. I don't have orgasms. Whatever the issues are, we can get into that some. And then, as one of my friends who's I was getting ready to do a consulting gig a few years ago, and one of our mutual friends, I asked her, I'm like, I need to go in there sounding like a consultant. What do I say? And she's like, talk about a gap analysis. And so
I know the friend you're talking about.
hi. So she told me to talk about a gap analysis, to go in there and look at like, what's the current situation? What's the ideal situation? And then we look at the gap in between, right? And then that's my job as the consultant, is to bridge the gap. Like, how can I line these things up? But I do want to understand that from somebody with low desire too. Like, what's your ideal sex life? How do you really want it to be? And I don't mean like crazy fantasy ideal. I mean real life fantasy ideal, right? Like, how do you want sex to be in your life? What kind of role do you want it to play in your day, week, month, year, whatever? And then why can't that happen today? What are the barriers for that happening today? And most people actually really enjoy this process. Like, I don't lose a lot of clients during these first few sessions because I think people really enjoy having a new sort of space to look closely at what maybe seems mysterious to them. But when we can walk through it with this kind of intention, they can see maybe that some things make sense, or that they haven't actually tried a lot yet. They've worried about it a lot, or they fretted about it or something, but they haven't actually tried a lot to make it different. So then that gives us some space to actually try new things and see if we can help this feel better.
Mm-hmm. I remember talking about the desire that once you get started and it starts to feel better, because I do remember a conversation with you that stuck with me of having a scale, and I think we may talk about this later in a different form.
Right.
At that time, it was if your sexual desire level is 0 to 10 and you're at a 0, don't have sex.
Right.
But if you're at 1, you should strongly consider it if you're someone that once it starts,
right,
you as long as you have the time and the space to allow it, then maybe you should open the door to it.
Right.
For that idea of a healthy sexual encounter, healthy sex life, that too is considered healthy.
Absolutely.
And then kind of going back to what you were talking about before, is having bad sex worth it? I would have to throw that to you. Is it worth it to have sex if it's considered, if the couple, or at least one part of the couple, doesn't consider it good sex, they would say it's bad sex. Should they keep having it for the sake of the relationship? Or
I am not a really big fan of bad sex.
that should be a
should I say that right into the camera?
I should repeat that.
I'm not a fan of bad sex. I'm really not. I'm really not a fan of bad sex. And that doesn't mean that every sexual encounter is going to be just absolute fireworks for both people involved. But sometimes maybe more for one, sometimes more for the other. Sometimes maybe neither one has the fireworks, but like it's still, we can get into some real detail here, how we define success and failure with sex. Because I think a lot of people's definitions of success and failure around a sexual encounter are really problematic. But for me, one of the elements of bad sex would usually be maybe not quite telling the truth about it. Like putting up with sex that doesn't feel good to you for some reason. Maybe it's about faking orgasms, acting like you like what you don't like, doing things that you don't want to do, that sort of stuff. Like, I don't see the point of that. I do see the point of what I would call maintenance sex, more than like somehow the stars have aligned and we've caught each other's eyes across the room and the next thing we have to do is go find some place to have sex with each other right now. Like, that's great if that ever happens. That sort of like spontaneous in the moment must do, right? But then we've been busy, we haven't seen a lot of each other, you're going out of town tomorrow, let's make some time tonight to have sex. That's what I think of as more as maintenance sex. It might not be the most amazing sex ever, but it's probably a better idea to have it versus not have it. Right. But the other thing I want to point out about that is that doesn't need to be the only thing on the menu. Like, if that's the only thing that couple can do is have that sort of maintenance sex every now and then, like, to me, like, there's more there for us to work with.
That really is like having the same meal for dinner every night. And
yes.
I think a lot of people put long relationships in that space, and I think that's wrong, because I do think, to your point, menu, because I think of a lot of different, as somebody who's going to be married 31 years next week, a lot of different sexual types of encounters are on our menu.
Yes.
So it can be very varied and Yeah. And we can choose.
Mm-hmm.
And sometimes scheduled is absolutely necessary, even without a kid at home.
Totally.
Yeah.
Right. Like, I schedule massages too.
Yeah.
Right? Because I'm not going to go knock on my massage therapist's house and hope she's home and doesn't have a client and whatever. It doesn't work that way.
And is in the
And
mood,
so,
playing the right music.
right, we're good, right? This is fine. No, I'm going to make an appointment. I'm going to schedule it and I'm going to look forward to it for the whole time that I can see it on my calendar. When people talk about scheduling sex, that it makes it feel like a chore, they're letting me in on something there. Like, because when I have a massage on the calendar, it doesn't feel like a chore. If I have vacuuming on the calendar, it feels like a chore because it's a chore. But a massage is a treat, right? And so if I have that on my calendar, I'm going to feel good feelings about it. I'm going to want to hold that space like it's sacred space, and I don't want something crashing in on it because it's important, because I want it, right? That's how I want people to feel about sex, and that's how I want them to feel about scheduling sex. That if it's something important to you, make space for it. Don't sit around acting like nobody really wants to do this. We don't, and then all of a sudden we're going to fall into each other in some passionate sort of sexual encounter. How about we make the plans? The same way that, like, if you and I want to have dinner, you can come over to my house and knock on the door at 7 o'clock and hope for the best. I might be making dinner and we might have a good time. We probably will. But I could also be busy with kid stuff or client stuff and maybe no food in the house, or there's 2 slices of cold pizza we can share or whatever. And we can make that work. But it would be better if we actually intentionally created space for it and then we were able to enjoy it.
And I think especially if you're choosing certain menu items that might take
Right.
a little more planning.
Right. Yeah.
Yeah, I like the idea of that. Yeah,
it's like a play date.
Yeah.
And I think that especially for couples whose kids have left the house, or maybe they go away to grandma's or something for Friday nights or something like that, a sexual date on the calendar, like that, it can be like a play date.
Mm-hmm.
And there can be intention that goes into it. Like, what do I want to wear? What do we want to do? What are we going to put into the space to make it good? There's a myth that during the first part of that relationship, sex was spontaneous. It was never spontaneous. It was never spontaneous.
No.
You shaved your legs. You wore the cute panties.
Tried on 2 or 3 outfits.
Right. You made sure you really felt good in what you were wearing. You thought about it all week long. Like, what are we going to do? The sheets were changed on the bed. There were candles by the bed. There was condoms. There was lube. There was whatever was needed. The batteries in the vibrator were fresh. All those sorts of things, right? Just because you knew you were going to have sex. Like, that was the expectation. Maybe something was going to happen. It wasn't going to go that direction, but you're Girl Scout, right? You're going to be prepared. I just did invoke the Girl Scouts in the middle of a hi, other friend.
Adult Girl
Yeah,
Scout.
adult Girl Scouts.
Former
right.
Girl Scout.
That's right. All of those things. But it wasn't spontaneous then. That's a myth. You were planning for it all the time. But then once you got into a relationship and there were other things to plan for, like where's that, which bank account's that going to come out of, and who's going to handle this and who's going to handle that. That's the stuff. The domestic is what starts to fill up the plate versus the erotic. Mm-hmm. Whereas early in a relationship, there's so much more space for erotic that it just feels like it's happening naturally, but it's not. It's just that there's so much more space available for it.
I think that's probably a good description for a lot of couples, because my guess is there's a mismatch there as well. There are people that feel like they're always trying to plan, and another part of the couple maybe only wants it to feel spontaneous. And I think just opening the eyes to it never really having been all that spontaneous is probably a good thing.
Right. It's never really all that spontaneous. And I really do think about it like kids having a play date. That, like, if you and I were in elementary school and we knew that on Tuesdays after school we got to go play at the playground together, we might have a sense of what we were going to do, but we might get there and figure it out. We might get there and one day decide, like, it feels today like we want to swing really high and then jump off over and over again, or we want to do that round and round thing, or the teeter-totter, or whatever the things are. We want to chase each other around, right? We don't make it a contract in advance for exactly what we're going to do with our time. We just know we're going to go there and we're going to enjoy each other and we're going to have fun. And I think we can bring that same energy to long-term married sex life in the same sort of way. Like, we don't know what we're going to do on that Tuesday or Friday or whenever it is that we have kind of earmarked that space for sex. It doesn't necessarily mean intercourse. It doesn't mean oral sex. It doesn't mean anything in particular other than just we're holding the space and we're showing up when our intention is to have fun together.
To that point, I remember fondly a long married couple, a woman that did have vaginal atrophy and a lot of pain with sex, but they still had a great sex life. And she made a point of saying we have found other ways
Yeah.
that we can still have sex and satisfy each other, because she was not a candidate for hormone replacement.
Yeah.
So there are various barriers to having penetration type intercourse, but that did not slow them down.
Yeah.
Yeah.
Good
So
for
it's just
them.
interesting to see different types of couples and how they navigate that aspect of their life. I feel badly for the couples that just choose to put it on a table and
Me too.
not go back to it ever again.
That makes me sad. I think that's losing a resource essentially that they have in each other that they're not going to benefit from. And it can be really hard. I think it's harder for couples to bring it back after it's been gone for a long time. I would say on average, the couples that come see me in sexless marriages, I would say it's been 7 years for most of them. That's a long time. So to try to bring that back in, it can be done. I've seen it happen, but it's tougher than maintaining it.
So spend some time maintaining it. So take some
Yes.
advice here and maintain. Follow me on YouTube at Dr. Laura Beaty, where you will find MDSpin podcast. Subscribe. Click the button for more health news you can use.
So this idea of this idea of transitioning from not sex to sex, that's how sexual encounters happen, is because somehow people went from washing the dishes to having sex, right? Something happens to transition from not sex to sex. And that's in the erotic response cycle. So the energies happening between a couple, that's in the early stage of it, which is the seduction stage. That's essentially the sales job of convincing yourself and convincing your partner that even though you're in neutral, or maybe you're feeling a little charge, or maybe you're feeling a little low, but you're in kind of the neutral range. But you think it's maybe a good idea. Maybe you could watch your show, you could go to bed early, you could walk the dog, you could whatever, or you could go have sex. You've decided that sex is probably a good idea. That's the seduction phase, the sales job of yourself and of your partner. And we talk a lot about our partners turning us on or off, and there's a role that's true. There's a role there. But really the biggest part of that is this thing we do for ourselves of getting ourselves in the mood. So one thing I like to ask women is, if you wanted, whatever word fits, to be in the mood enough tonight to initiate sex, like what would you need to do between now and tonight to get yourself enough in the mood to be able to initiate sex? So I'm wondering, Laura, what you think, if you needed to initiate sex tonight, what would you do? And then we'll talk about not do also between now and tonight to kind of put you in more of that yes place than a no place. This is about recognizing that we all have a brake and we have an accelerator. And part of what happens for women in our culture is that we get really good at pushing the brake. We're told a lot that that's important. We're really good at finding reasons why sex is not a great idea. But getting more familiar with the accelerator is knowing that sometimes we want to be able to say yes. And so it can be an empowering thing to realize that. So for you to initiate sex tonight, what do you do between now and tonight?
Well, you're saying tonight, but I was thinking about it differently, because I think it depends on where I am, or what space I'm in. And I think that if I'm in a good space, I'm already thinking about it. I already know the time is there. Then it can be as simple as just listening to music. It can be as simple
Music
as
is
putting
great.
playlists together, or a playlist that I already have together, or there's lots of playlists out there on Spotify.
I'm sure.
In the mood, I mean, you name it, search it, they're there. So I would listen. That really helps me. I would probably make sure and take care of the busy parts of life early, walk the dog early, dinner a little, whatever needs to happen along those lines. And then I would probably ask my partner how interested he is.
Yes, to make some sort of overt.
I don't want to go too far.
Right.
If he's
up for this.
He's on no.
Right.
And then on the other hand, if I'm a little bit further from that desire, let's say I'm trying to make myself there because I know one of us is going out of town, and I think it's an important part, and I want to do a little bit more than maintenance sex. Then it might even be reading erotic literature, but finding a little bit of time in my day to get my head in that headspace.
Yeah.
or getting home a little early and allowing time for that. But for me, it's very mental.
Yes. That's the sort of list I would get from a lot of people. The thing about music, listening to music that kind of gets them in that space, or reading a little something, looking at a little something, letting themselves think about maybe some time recently that they had fun sex, kind of that remembered sense of fun or wellness or something. Making the space as far as clearing off the to-do list and such as that. Imagining it going well, checking in with a partner, like, are we in this together? All those things help. For a lot of people, something like a light meal instead of like a 5-course something or other. Maybe not having too much to drink, not feeling just too full and heavy, that sort of thing. Maybe a little power nap helps, or going to get a little exercise. Sweat is an amazing thing for desire. So just going and doing a little something like that. Those are all things that people can do that help to kind of push them into the direction of yes, if they're in neutral. People can wear things that feel a little extra. It doesn't have to be the fishnets and the heels and the whatever. It can be. It doesn't have to be. It could just be those really cozy pajamas that feel good and relaxing and like they're good for that kind of space. It can be all of those things. And then there are all the things that we wouldn't do, like maybe not start talking about something super challenging, or not start opening up some big project, something that's going to be heavy in whatever way, emotionally or intellectually or something. Those sorts of things are all, we can avoid those if what we want to do is get in the mood.
Our very worst date night was one we planned after going to the accountant toward the end of year tax planning.
No.
We had
That is not foreplay.
It was awful.
Yeah.
It was the worst date night. Yeah. 31 years. That was the worst.
Oh, yeah. That does not sound sexy.
No.
No.
Not sexy at all. I'm not sure who had the planning there, but it did not work. It did not work well. But, and I think you can do some spontaneous things, which are sometimes fun, especially around events or trying to celebrations. I know that surprising someone with a key to a hotel room, some of those things can be fun too, which is a little bit more advanced planning.
Right.
But still fun.
Absolutely.
I'm a planner. You know that.
So I do know that about you.
Planning part. I like the execution part too, but I really like the planning part.
I think planning for stuff around sex is super fun. Like I hate it when people don't really feel like they have a permission slip for such things, and like they're supposed to accidentally let it happen in the dark at bedtime. They're just kind of, their bodies find each other. Like there's a lot that gets missed because there's so much positive anticipation when you're actually able to plan something.
How much is over romanticized, or maybe even not romanticized, but how many people think that what they see on screen is what they should be experiencing in the bedroom?
I think a lot of people think that way.
That's unfortunate.
It is unfortunate. And especially around this idea of starting from neutral, I hear it from men and women both, that they don't understand that neutral is a good starting point. Like it really is. Neutral is not negative. You mentioned earlier a scale I have from 1 to 10 and of how in the mood somebody is. And that's to help people get out of this idea that it's binary. I'm in the mood or not in the mood. It's not like that. There are degrees to it. So I think about it from a scale of 1 to 10. 1 is willing. It's being in sexual neutrality. I could take it or leave it. Honestly, like there are 5 things I could think of to do. Sex is one of them. It's in there, but I'm not really feeling a drive for it. I'm not feeling aversion either. It's in there. That's willing. 2 and 3 is like more wanting. 3 is when during a sexual encounter, when lubrication might get started, erections might get started, other things happen that happen during arousal. That's not a 1, that's a 3. And so that usually we're not walking around in that state of arousal. So that means we've gotten into it from neutral and we've built up to a 3. And then we keep climbing up until 7, I say, is craving. And that's when changes are happening in the outer part of the vagina that make it ready for penetration if that's what somebody wants to do. There's more lubrication, more erection, more stuff happening to facilitate intercourse, again, if that's where a couple wants to go. And then 10 is coming. So we've willing, wanting, craving, coming. And I do get made fun of for my alliteration. But that's my 1 to 10 scale. Well, I've recently created a negative 1 to 10 scale also, because I used to just say 0 was negative, and there's truth to that, but I think there's also degrees to it. And how that's really helped me with clients in the past couple of years that I've been thinking about it that way is that we usually want to move, like the goal can be to move like a degree or a point, right? What's adjacent to it to get us closer. So if something's a -10, like they are seething with rage or they are exhausted, they haven't slept for days, they've been in the hospital with their child, they are probably not about to get warm and cozy and start lubricating and whatever else is happening. That's not going to happen. There's a whole jump that has to happen emotionally to get from a -10 to a 3. But if they're a -4, if they're just a little grouchy and a little tired, maybe some things can be done that move them up closer to 1. Does that make sense?
Mm-hmm. It
So
does.
understanding for yourself and for your partner what the current level of aversion is, if there is an aversion, like how much they don't want to have sex, and what needs to happen to remedy that to get them back up into neutral. But neutral is a fine starting point,
Yeah.
which also means starting without lubrication. It means starting without an erection. That these are things that often for people over 35, that's the first part of a sexual encounter is the arrival of those things.
Mm-hmm. Deciding at the same time that they're going to take
Yes.
to the next step.
Yeah.
And things that impact desire, we've talked a lot about things that positively impact, things that negatively impact. And then you had, again, the word on here, desire killers. To me, that is almost even more extreme than what we've been talking about. Like and I'm sure it's different for everyone, but what are some more common desire killers?
Anger is a big one, especially for women. When we're angry, we're not usually feeling super frisky. And so anger's a big one. Anxiety and depression are right in there too. If you're feeling like nothing is worth it, you're not worth it, everything is bad and wrong, like a lot of people feel during depression, it's hard to access sexual energy during that. And then anxiety also, that same thing as far as shutting it down. The other thing is having a sense with your partner that the sex is not going to be rewarding, or that it's in whatever way it's not an emotionally or physically safe space. Then again, it's tough to get in the mood for that. So those are the things that come to my mind first around desired killers, things that like, that is going to douse it. It's really going to be hard. Like we got some work to do with those. And then of course the other ones like we've talked about, like the fatigue and stress and, having a to-do list that's a mile long and really feeling like your identity is wrapped up in how well you get all of the things done. We might show our people our to-do list and how many things we get to mark off, but we're not maybe going to put sex on that list. Like that's a more private thing. So anyway, that's kind of a reconfiguration of some priorities there.
Mm-hmm. Maybe, we should start sharing and saying, yes, I
right.
to-do list yesterday, got it all done.
Right. I planned a play date.
An adult play date.
Right.
Yes. The desired killers, I was thinking of even more specific. Certainly, I agree. Anger is a big one. I think for me, once I have the thought of going to bed, if I already have the fuzzy socks on and then my head hits the pillow and the thought is sleep when the head hits the pillow, I can't go back from that. So I'm pretty sure I'm in the negative space from there.
Mm-hmm.
That's probably the biggest one.
Mm-hmm. Yeah. I think a lot of people can relate to that, especially now that it seems, this is not a new thing, but it's hard to get enough sleep.
It is.
So,
You found my podcast, MDSpin, on YouTube at Dr. Laura Beaty. Today, my guest is Angela Colbreth, a licensed professional counselor focusing on sexual and relationship health and wellness. So where should we go next?
Well, I like this idea, the thing I have here about the study that was done in 2017, 2,000 heterosexual women it sounds so fancy. It's evidence-based activities that increase sexual arousal in heterosexual women.
2,000 women in the study.
Mm-hmm.
So, that's a good sample size.
So I'm going to read these things to you.
Mm-hmm.
Yeah. 64% of women in the study found that they felt more arousal and desire if their partners kept touching them during intercourse.
Seems obvious.
Oh, wait, let's be more specific. 63%. So 1% this wasn't being done in a very favorable way, apparently, but like when he continues to caress your clitoris during intercourse. That's a great idea. Wow. 57% found that having oral sex before intercourse increased their arousal and desire. Right. Isn't that surprising?
Sad for the other 44%.
I like this one. I know. 55%. He kisses you at a specific place. It's undisclosed. We will not talk about where that place is. We all have our special places. But if he kisses you at the special place, 55% of women are going to feel more into it. How about this? He says erotic words. Some of us might call that talking dirty, which can go south. We get it. Like, it's not always, some people cannot pull it off. Some people cannot hear it. It just doesn't work. But for 54% of these 2,000 women, they found that if he says erotic words during sex, they feel more in the mood. How about this one? 51%. You watch his pleasure and his arousal. So that basically is you tune into your partner and like you're turned on because they're turned on. And like then there's this positive feedback thing of.
Yeah, the kind of the give and take and it builds
Right.
together.
Right.
Want, at least.
Yeah. For a lot of people, that's their arousal style. And they're turned on when their partner's turned on. That works for them. And in this study, 51% of women were more into it if they noticed his pleasure and arousal.
And his moaning.
Oh, his moaning, 49%. So
Yeah.
2% don't like the moaning. This one, 48% focus on, this, I like this. You focus on the intercourse and the activity that you're doing. So basically,
You're
like,
not thinking about cleaning the kitchen.
well, they're not cleaning the kitchen. You're focusing on what you're doing. So this is like basic mindfulness. If you're focused on what you're doing, you're going to like what you're doing more. That's really
probably true for everything, but
fancy. Which makes me think of another study I saw recently that was assigned women to different categories of what to think about during sex, like an erotic thing they had read, a memory, or their actual pelvis, like vulva and vagina, to actually think about what they were experiencing. And those were the winners. That was what the study showed, is that women who were focused on their vulva and vagina, right, actually liked it more than people that were using their brains to think about other sorts of things. Our brain is our biggest sexual organ. We got to make the most of it. And that's what that study showed, is that to use it to think about, to really connect with what's happening in your body is a turn on. How about this one? 47%. You play an active role and get involved with the sex.
I think that's, yeah.
I get it. Like, I hear a lot of people tell me about their typical sexual encounters, and a lot of them aren't very sexy. That's true, which is why I have a job, is helping with that. But like this one, you get involved and do things. So like if you feel empowered, you feel active, you're activated, you're not the pillow princess, I've heard, is the category of women that just want to lie there and have sex done to them. Apparently, it's more fun to be actively involved in the process. You focus on his body, 41% are going to be more turned on, and 38% you focus on his smell. I thought that was kind of interesting also. Like pheromones and just feeling there's a lot of connection in what we smell, right? So when I read this the first time, I thought, what are people doing if they're not doing these things? But that says that not everybody's doing these things. And so that tells us a lot about what this low desire is, that maybe we have kind of an epidemic of bad sex happening because we haven't really taught people how to be great at developing their own sexual self. We haven't really taught people how to be great lovers, how or why to prioritize sex and eroticism in their relationships. And so part of the fruit of that is that we find out through research that if you touch each other during intercourse, it feels better.
And if you pay attention to your body.
If you pay attention to your body.
It feels pretty good.
You might like what's going on. I'm like, that's amazing, isn't it? So anyway, that's a study that I thought was kind of interesting about women with low desire. Again, it tells me that, yes, I might need to teach these women that these activities would be a good idea. But if I'm having to do that, I'm also probably going to need to be starting at the beginning with teaching them how to have sex, because that's really what this is.
Mm-hmm. And, I think anorgasmia we should have
a whole thing or
future discussion about, but I would imagine there is some interplay here of women that find it challenging to have an orgasm, enjoy sex less, become a little bit more shut down, and how that plays into the whole picture. And that can be certainly people that have had normal orgasms and then suddenly do not,
Right.
or people that have never had an orgasm. I don't even know what the percentage is anymore.
I don't either.
I think it's substantial.
It's enough. I mean, I see it at work a lot.
What do you think the maybe percentage, maybe I'm just asking the question wrong, but how many women that you see typically use fantasies or do kind of put their brain in different places when they're having sex? And how does that fuel or decrease from the encounter?
So there are two things about this that I would want to address. And one is arousal styles. There are 3 main arousal styles, and I usually ask my clients to put them in order. We can all relate usually to all 3, but we have a primary. So the first one is partner interaction focus. And so those are people, like we were talking about with the research, that they're going to get more turned on because their partner's more turned on. They're turned on because their partner's being nice to them or attentive to them. This partner interaction piece is the thing that's really hot for them. The second category of folks are the physical sensation people. They're going to get more and more turned on because of what their senses are telling them, what they're experiencing in their bodies. And the third group of people are the cognitive or fantasy folks, and they're going to increase or enhance their arousal by using their brain to kind of fancy it up some. And so that can be about memories from the past. It can be fantasizing about another person. It can be heightening the situation somehow by adding in some fantasy that feels erotic. Most people fall into that first category where the partner interaction focus is important. And then this physical sensation or the cognitive and fantasy would be their secondary one. We tend to think that the partner interaction people are like the great lovers, but like everything, there's upside and there's shadow to it in any of these. And then people that really use their minds to get more turned on can be a little bit maligned. Like you're not really in the moment. You're not really with your partner. You're going off in your head somewhere. In fact, I think that sort of judgment of it is not appropriate because usually what they're doing in their head is helping them feel present and connected,
Right.
but that might get missed. But that is a very normal mode of increasing arousal is to kind of heighten it. And I don't know percentages of how many do it. I will know a lot of people do it. If I say 10 on my 1 to 10 scale, 10 is currently having an orgasm. By about 9, usually people are adding some fantasy in to help get to climax.
Okay.
So that's one piece is arousal styles. And the other thing is that cognitively, a thing that's really important to facilitate arousal is this process called cognitive narrowing. And I think of it like the top part of a funnel down into the skinny part of a funnel that usually, especially women, but we have so many things going on in our brain at one time. It's like we're up in the wide part of the funnel where we're thinking about so many things at once because that's what our brains are made to do. But in order to really facilitate arousal, we need to get more and more in our bodies and more grounded in the present moment using our senses. And that's that cognitive narrowing process, or the part of getting to that skinny part of the funnel. That can be done, again, by tuning into our bodies and noticing what's happening, and also using fantasy to enhance that.
I haven't bought the book yet, but Gillian Anderson just released a book
of erotica, right? Like erotic stories?
I think it is of fantasies, sexual
Is it?
fantasies. I mean, it's one or the other.
It's something
But
with
I want to
fantasy.
buy it. And
Mhm.
she did the Netflix show.
She does it.
Education.
Yes.
This is X-Files, Gillian
Mhm.
Anderson. She's
It's a great series. Like,
I
as a
watched
sex
the first
therapist
season.
who
It
had
was-
teenage kids, like that, I have really enjoyed that over the years.
Yes.
Yeah.
You could have been the lead in that show.
'Cause
I remember sending my daughter and her friends to
Mhm.
when they were 15?
That happened.
To have
A talk.
a safe space to talk about things that you might not want to ask your parents about. And I know that they all appreciated that very much.
It was good. I enjoyed it.
Let's say that a person or a couple have been with you and they've kind of moved down the chain of different things, and that they're still having bad sex. What are some of the solutions? And I know you had kind of created even some ethical questions around some of the potential solutions that different couples have chosen for
Right.
themselves. And obviously, ending a relationship
Right. That happens.
can happen with some of this. And usually, my guess is that it's not just this issue, but this could be the issue that breaks a relationship.
Yes. There are things that we do, right? Like we talk about how important it is for both partners to own the responsibilities and the privileges around initiating, for example, and planning and making the space. Let's both be empowered and skilled around that. Having meetings sounds so sexy. Having meetings with each other to check in about how are we doing sexually? What do we want more of, less of, different of? What's an edge that we can explore? What's something new and different that we can add in? All these things need to be happening. And for couples who are in long-term sexual relationships, that's the sort of maintenance that needs to happen in order to keep it good. There are lots and lots of ways to approach increasing, like having incremental changes in a good direction. However, if one partner is not willing to participate in that, or for whatever reason that the ceiling is low, like they've maxed out where they're going to go, that's an extraordinarily difficult place to find oneself. And like you said, maybe most relationships that end because of a sexual problem, that wasn't the only problem there. I think some of the saddest situations that I've seen are the ones where it does seem like, yeah, like other than that, everything seems great. So there's a lot to lose.
But you think about that, and that seems very like a different relationship. You would be choosing to be with someone to partner with, and going back to the sexless marriages, it's more brother and sister like all of a sudden. You have a special love and a bond, but you've taken something out of it that made that relationship very unique.
Yeah.
Right?
Yeah, for sure.
I don't know.
Because I love the saying about that sex isn't a thing that we do, it's a place that we go. And the thing is, like, if I really love to play tennis and my boyfriend and I meet each other on the tennis court maybe, and for the first few years we play tennis together, a couple seasons a year, we're having a great time, and then he has an injury, or maybe he decides he doesn't even like tennis anymore. That might be sad that I can't play tennis with him anymore, but I can keep going to play tennis. I can play tennis with other people, and I can still be a tennis player. But when you're in a marriage, unless there's some fancy footwork going on around ethical non-monogamy, we're involving other people in this, we're going to have other partners, there's something else going on like that, which happens, and sometimes that works. Usually it doesn't work, but sometimes it works. But unless there's something like that, you can't go just do that with somebody else. And so then if your partner gives up that identity, then you have to be holding also, am I giving up that identity also? If sex is a place I want to go and you won't go there with me, what am I going to do? And that these situations, these make me very sad. Like when I have people asking me to just try to help turn it off, that they don't want it anymore, they don't want to need it. I have clients who have gone to professional cuddlers to have non-sexual affectionate touch, because often if the sexual touch isn't working, the other kind of reassuring, affectionate, sweet touch, it all stops. And so then in feeling like they're in this desert of touch, they go and they engage people for services in a way that feels ethical or okay to them, whether it's cuddling or something sexual or something, or they try some kind of opening up the marriage or whatever, which, like I said, that usually only works when there's a great solid foundation that people are building on, which is not usually how people do that. So anyway, it's just, that's a sad thing.
It's sad. It takes me back to the couple I was talking about earlier, that he obviously had a desire. We were treating erectile dysfunction and hormonal, boosting the testosterone, and she was absolutely not. That's a relationship ender for me. And that was just very sad because obviously,
right.
Yeah, just major mismatch.
There's a television series right now. I don't know if you've watched it, Dying for Sex.
Oh, no, but I listened to the podcast.
Did you?
Yes,
I've not listened to the podcast. I've seen the first 2 episodes, and I'll tell you, I already want to teach a class to other sex therapists about all the themes that are in the show so far. But essentially, it's not a spoiler to say that she gets a big diagnosis and then decides to go on a sexual journey. And
uninhibited. sexual
Right.
journey.
And they show beautifully some dynamics in the marriage, like why sex isn't working there, and that it feels to her like a life thing, which is that alive is a word that people use when they describe how they feel when they're in a good place sexually, that there's a sense of aliveness that they feel. Yes, there's a connection with their partner. There's something sweet and special about having that experience. You go to that place with a person. That feels great. There's a sense of aliveness, which is why it's important when people are in hospice or in the hospital trying to get well, or when they've gotten a big diagnosis, for them to have guides to help them integrate sexuality into that, because sexuality, for whatever time they have left, is probably going to be a thing that helps them feel alive.
And I love the relationship, the friendship. And
Yes, the friendship in that and dying for sex.
And I haven't watched it yet, but the podcast, again, truly, truly amazing. So
It's really good. And it speaks to the not silliness of the subject. Right? Like, it's really important to people. It's not silly. It's not just about wanting to go have a little fling or do this or that. Like, it really is about accessing something inside of yourself that helps you feel more like yourself, that you're more vibrant, more alive. I know that this whole desire thing exists on a spectrum, and there are some people that hold the identity of asexual, like I have no interest or desire in sex, and that's part of my identity. I'm okay with that. And I don't like to be at odds with other people's identities. That's fine. And at the same time, I feel a sense of sadness, because I think there's something that person is going to have to compensate for in some other ways, about the vibrancy and the sense of aliveness that we can have when we are in a good place with sexuality. And I'm not an expert on asexuality. I'm sure somebody that is could explain to me how that works. But in my sense is, when people come to me and they want to feel more around their sexuality, I think that's a journey worth taking, because I like I said, what it creates in people as far as the sense of being alive and vibrant and fully whole and things like that.
And back to dying for sex, we have a show about a woman that has a diagnosis. Usually you would think about this as a very sad show or sad podcast. It was so much the opposite. It was so full of life, and it was so full of humor.
Yeah.
I think that's what I appreciated a lot listening to the podcast. So I can't wait to see the show.
I think you're going to like it.
Yeah.
Yeah.
So, so for all of our watchers, I'm sure that you're going to have some questions, and I do have access to my friend, the sex therapist here. So if you want to put some questions in the video, I will periodically be answering those. And for today, our assistant did capture a few questions because he knew I was going to have a sex therapist on the show. So what are those questions, Jonathan?
Is there a female Viagra?
Actually, that question I'll answer. Unfortunately, the answer is no. There is no female Viagra. For women that are having low sexual desire and a hormonal component, we will often add testosterone. That's commonly used in Europe, but becoming more common in the United States. And I think it helps. There is topical things that we can use to rub on the clitoral area, topical Viagra even, because it increases blood flow. Viagra started as a very poor blood pressure medicine, and a lot of men had erections, and then Pfizer made a boatload of money off of that drug.
Yes, indeed.
So, but we can use it in interesting ways to help, and we can kind of create a cocktail of medications that women can rub on their clitoris to get engorgement, increased sensitivity. And then there are 2 drugs that are FDA approved for hyposexual desire disorder, but neither of them are very good. One is called Addie, and it is not approved for postmenopausal women, which is kind of sad. And for premenopausal women, it cannot be combined with alcohol within 2 hours because everyone has syncope. They pass out.
Oh my gosh.
It is anywhere close to alcohol, and there's just a lot of side effects to it. Dizziness. It has not caught on. I don't think that's not our Viagra. The other one is Vyleesi. It's an injection, and that one you can use it when you want to have intercourse, but it's really, I think, another poor performer. So comparing the injection, placebo had a 17% response. The injection was 25%. So really only about a 6% difference. And 40% of the people had nausea and dizziness. So again, we just
Oh,
don't.
yeah.
Unfortunately, big pharma is not our answer here. So
No.
we're back to the drawing board, and definitely see your doctor, talk to them, and find your local good sex therapist, because it's very important to dig deep to solve these kind of problems.
How are dating apps affecting my sex life?
Well, that's a good
That was
question.
G6.
Yeah, how are dating apps swiping right, swiping left,
Oh my gosh.
impacting sex? Transactional, kind of, I guess.
Well, so the dating apps that I hear the most about in my practice are the ones for people who are in the kink or fetish world.
Okay.
And they're fun, actually, because what you do in those apps is you really put out there who you are sexually, and you look for matches around what your kink is. You find somebody that's a real kink.
A furry?
Yes, it could be a furry. It could be so many things. But you lead with your sexual identity, and you find somebody that really connects with that sexual identity. And I think about how that stands in contrast to the typical sort of mainstream dating apps, where you're swiping based on a first impression of what somebody looks like. So that's maybe looking for a different sort of compatibility. But the ones that are specifically in the sex world seem to focus on sexual identity, really finding a match for that, which I think is different. But it's hard probably to walk into the Applebee's and start interviewing people to find out like who your people there are that you might have some connection with, right?
Good point. So it's helped one.
It can
area.
help in that.
Yeah, I can see that.
Yeah.
How do you feel about, because I'm still trying to wrap my head around some of this that's gotten recent attention, the OnlyFans sex marathons that, of course, these women are becoming millionaires. And I mean, if more power to you, but it does sort of take away from the whole sexual act as a place or an experience, because when you look at these marathons, have sex with someone, I haven't watched them, but it has to be 30 seconds.
Right.
In, out,
Right.
move, because that's the only way the numbers work. So it's not
Right.
really having sex.
No. No, I think sex is supposed to be an awful lot more fun than whatever's going on in those videos. And I think that's one of the sad, porn would be a whole different conversation. OnlyFans, that sort of thing, there's a lot there for us to talk about. But in general, what I think is not so great about people learning about sexuality that way is because it leaves out a lot of the fun part. Like, there's not the laughing and cutting up, and we don't see the blooper reel when things go wrong and somebody ends up on the floor or whatever. Like the sort of things that go on in sex that make it tender and fun and silly and like you have an inside joke with each other, because so much of what we see in like the sexual entertainment world is super transactional. And so I like to if people are ever feeling intimidated by porn, like the bodies or whatever in porn, what I like to focus on is I want you having better sex than that. I want you to be having sex that is so much more fun than that.
What about the shows like Love Island? That's my daughter's all the rage right now. On
I am
Love Island.
Thankfully completely out of the know of whatever that is.
Yeah,
like,
I don't really know either.
Yeah,
But
I
she had
can't
me
do it.
Watching it with her last
I cannot do it. I can't do the reality relationship stuff, whatever. It for some reason I feel allergic to those things.
How do I tell my partner what I really want in bed?
I would say, ideally,
words.
if you're English speaking and English, that is my first piece of advice there. That it actually gets talked about. But I like it when couples have kind of a standing date with each other to have a catch up, a check-in, a sexual check-in with each other, where it becomes a totally normal part of the relationship to say like, hey, there's this thing I've been thinking about. That's not going to be the first time, the once a decade, whatever, where a thought like that gets shared. So that part, directly in your native language, that sort of thing, like use words to talk about this and to be clear about it. And that needs to happen, because if we don't do that, then we create a sex life that's not super fun because we haven't been open about what would be super fun to us. I think an equally interesting question related to that is, how do you respond when your partner tells you what they really want to do? And I would say it's important to respond well.
Not with your mouth open.
Yeah, like don't be a jerk, right? Don't make that face. Don't be a jerk. And don't start by being evaluative around it. Like I'm not really into like cowboy hats, so like I don't think that's a thing. Start off with something else like that encourages the creativity and the intimate and vulnerable sharing that somebody just did with you. Like, really, I didn't know that. Like, I'm really glad you told me that. You could even say something like, "That sounds kind of hot. I can imagine. Tell me more." When will we do this? Who's wearing the hat? Whatever the thing is, like try to facilitate getting more information so that the person that just shared it with you doesn't feel like a jerk. Like what that is, that's a bid for connection. That's a bid to be known better. So that person has just walked out on a limb to tell you something that feels important to them. And I would say that that is a moment when it's really a good idea to call in some mindfulness and some presence and respond well versus flippantly, because that's like somebody showing you their little piece of art or their little something or telling you about a new idea they've had. It's kind of a tender moment.
One last question. With 10 years ago we didn't have OnlyFans, 5 years ago probably got Awakens. AI is coming fast. What's the biggest threat to healthy sex in the future? What do you see coming down the road? Trying to prepare for all these things.
Threat or benefit, I guess.
AI and sexuality has been a conversation that's up in my professional communities a lot lately. I've been tuning in more because I've been having clients come in more and talk about their experiences with AI. Often it's talking to the AI chat bots or whatever to help with problem solving, relationship issues, and things like that. But sometimes it's for sexual companionship or sexual encounters. So the fact that I'm hearing it in my office means I need to start paying attention, even though I've tried to just pretend like none of it's real. Instead, I'm learning that I'm going to have to pay attention to those things. I don't know what impact it's going to have. I would say it's going to be a thing.
How advanced have sex dolls and things come?
I think they're pretty advanced.
I think so too. And I wonder AI in that space is going to make that pretty interesting.
Yeah. The thing that worries me the most about it, I mean, I don't think I'm unique in this particular concern, is that human beings are flawed, right? We're imperfect. We have imperfect attention, imperfect bodies, we're just imperfect. And you can really create this AI world where you're getting perfect responses. You're really getting the feedback that you want, the words you want to hear, the attention you want to get. And if you compare like your actual human partners to things like that, then they're going to be a disappointment. It's not going to feel good.
Similar to watching it on screen. It's just going to be a different type of encounter.
Yeah.
And you would want that to not take the place of the human encounter.
Right.
A huge thank you to my guest, Angela Culbrath, licensed professional therapist in Atlanta for sex and relationship matters, and more. And more. Hopefully you'll come back. I want to thank you so much for coming.
Yeah, I'd love to. Let's do this again.
There are lots of topics that we can talk
Yes.
about.